Question number 63. A 38-year-old woman undergoes a cervical percutaneous sympathetic nerve block for relief of hyperhidrosis. 2 hours after the procedure, she becomes distressed and is observed to have a labored, gasping respirations, a pulse rate of 110 per minute, and a blood pressure is 105/70. Which one of the following is the most likely explanation for her symptoms? A woman undergoes a cervical percutaneous sympathetic nerve block for relief of hyperhidrosis. 2 hours after the procedure, she became distressed. So options are hemothorax, option B is pneumothorax, option C is diaphragmatic paralysis, option D is anaphylactic reactions, option E is spinal shock. The hyperhidrosis can be a troublesome problem and affect about 0.5% of the population. This uncontrollable sweating most often affects the axilla, palms, and soles. Most cases are unknown cause, but any management of the patient with hyperhidrosis must consider possible underlying causes such as hyperthyroidism, pheochromocytoma, and various psychiatric disturbances. Mild cases of primary hyperhidrosis can be treated medically and with antiperspirants containing aluminum chloride. More severe cases can be treated with sympatholytics, anxiolytics, and sedatives, but these regimes will often have unpleasant side effects: blood, vein, constipation, and palpitation. When the drugs are taken in a concentration required to control symptoms, more recently botulinum toxin A injected into the stellate ganglion has been found to produce good symptomatic relief from excessive sweating in these patients. Preliminary percutaneous sympathetic blockage under imaging control can be used in an initial therapeutic trial. The stellate ganglion of the sympathetic chain lies anterior to the neck of the first rib, medial to the T1 nerve root's contribution to the brachial plexus. The stellate ganglion is the pathway for sympathetic outflow to the arm and face from the lateral T1 spinal cord segment. The dome of the pleura is immediately anterior to the ganglion. Surgical approaches include excision of the skin and associated sweat glands from the affected regions and endoscopic thoracoscopic sympathectomy. The latter has now replaced the open approach with reduced operator morbidity. Endoscopic sympathectomy does have its risks, and these include hemorrhage and pneumothorax. With this patient, a clinical scenario where tension pneumothorax due to injury to the pleura and underlying lung is most likely than a hemothorax. Longer-term side effects include Horner syndrome and gustatory sweating. Diaphragmatic paralysis from phrenic nerve injury is extremely unlikely, as is the spinal shock. An anaphylactic reaction to the injected agent is possible diagnosis, but the clinical features are more suggestive of tension pneumothorax. So option B is correct, which is tension pneumothorax.